Welcome back to First Take Live, and now I have my voice back, and some of my words are actually going to come out in a proper order. Tonight, joining me today is Dave Harper, Dr. Dave Harper, chiropractor, who says actually he is very pleased to go to a workplace presentation and say, I am a chiropractor, and not worry about the old stigmatism.
That's correct.
Yeah, because the old stigmatism was, you know, you're a bone cracker. Once you go to you guys once, you have to go to you forever.
Yeah, we hear it all the time.
Yeah, you know, all those stuff. And now you say with this technology, and maybe you can pull over your little friend.
Very obedient friend.
Put it in your shot because,
okay.
There's your obedient friend.
Okay.
Come over a little bit more.
There
all
we
right,
go.
there we are. Now I want so this is somebody's back, or not really, but it's a model of it. And the way that this adjuster works is that it's placed on the spine.
Yeah, the patient is lying face forward, as you saw in the picture earlier, and this just taps on each segment of the spine, and it registers the motion or the mobility or its lack of fixation, and it records that and it registers that as I showed you on that scan.
Okay.
And then, based upon the area that has the greatest level of fixation, I can now accurately, using the technology, focus on that area.
Will this know how much load to put onto it?
Yes.
The computer will say...
I can pick the load,
okay,
but it will pick the actual frequency and the timing of it.
Okay.
So there's still a certain amount of smarts to that, but when it's done, when it registers that that segment no longer requires any more help...
Cleared.
Cleared.
Yeah.
And then we rescan. And the idea that I showed from the last snippet there about that graph is that we want to see the vertebra become more normal. Here's the reality. Everybody has to move.
Right.
You know, and in my clinic, the clinic name is M.O.S.A.I.C.
Right.
Well, M.O.S.A.I.C is an acronym. M.O.S.A.I.C, the M of M.O.S.A.I.C means to move well. So the whole concept, the first issue, the first thing that people need to be aware of is that they need to be able to move.
Right.
How old do you feel when you can't move? Pretty old.
Yeah.
You can't do the activities of your daily life, work environment. So when we use this technology, we're able to restore the motion back into the spine without bringing other segments into it in a significant way.
Now,
so it focuses on one at a time.
So now I don't want to try and get you in trouble here, but I want to ask a question. And that is that normally when a manipulation is done to the spine with the hands, and I have mine done, not by you, I mean I have a chiropractor locally here, but there's a push down, and sort of, you know, you don't necessarily hit as specific as that. I would think it would be impossible to use the palm of your hand and not hit a few things.
That is the art of the chiropractic adjustment, is to be as specific as possible.
Okay.
We're just using technology to bring it up a level. Okay. I mean, medicine, the same thing. I mean, they used to do surgeries without the use of cameras or technologies or lasers.
Yeah, yeah.
Now they're doing that, and they're just bringing it up a level.
Right.
We're just there's nothing wrong with that, and that doesn't mean that it shouldn't be done. It's just that we're bringing it up a level.
Right, because we can.
Because we can. Like, I mean, would you rather have technology used on you that could bring it up or not? I mean, it's a no-brainer question.
Okay.
Yeah.
Thanks. Well, I try and ask a few of those during the show.
Yeah.
Now you have this laser thing. The laser.
The laser, yes.
You had it on a couple years ago. It was kind of new to you back then.
Yeah.
And I remember seeing it at the Parker probably a year before that. And what does it do?
The laser provides energy. And so the energy that the laser provides has a healing quality. There's a whole background of research behind this. But the essence of the laser is that it's able to provide an energy that can help to repair, to restore, and to heal areas of the body. What we don't realize is that we get sick when our energy becomes lower, or lower energy results when we get sick. Our body's ability to resist and to have capacity to resist is taken away, and we get sick or we have a problem. So if we can provide energy, let's say, to the nervous system, then we can actually restore some of the function to that nervous system performance.
What relationship are you seeing to with things that we now see with ADD and chiropractic adjustment and ADHD, people coming in? I don't want to call them those things, but they're subluxations. Have you noticed you've been able to help people, maybe kids that are being diagnosed, otherwise saying, you know, that there's some interference? And
Actually, that particular aspect of healthcare is not a focus on my clinic.
Okay, what is?
Sports. Sports, athletics.
So, I mean, if you're not an athlete, don't go see you?
No, I mean, everyone has a performance issue in their life. But my ultimate passion area is helping to restore in the young athlete and the teenage athlete their performance and help them achieve their dreams, their goals.
So you would think that every sports team and has their child, every parent that has their child that thinks is going to get a scholarship to the U.S., which I think is half the people I've ever watched play, rep soccer up until age 11, that they'd be all getting their kids adjusted by you?
Absolutely. I mean, that would be my bias. The best example I have is a young back catcher, 19-year-old back catcher that drove about an hour and a half to get into me from just west of me down around Chatham a couple summers ago. He was a very excellent athlete. He had a scholarship to an American school, about $18,000 a year U.S., and his problem was that he couldn't throw. Now, as a back catcher, you need to be able to throw.
But he was never a good thrower? Or
no, he was a good thrower, but he had a shoulder injury. And so he drove the distance down the 401 to get into the clinic, and within 3 to 4 weeks we had him throwing. The cool thing about this particular case was not only did he perform well, but he had to compete against 2 other back catchers. And so their team went undefeated for the year. He was able to maintain his scholarship. He was able to then go to a Pac-10 university and take a scholarship even further in terms of his baseball career. It was a wonderful case and a wonderful situation, but that's the example that just is my passion area, the young athlete, to keep them in the game. Parents buy the best skis while we're in winter. They buy the best skis for skiing. They buy the best hockey equipment. But you really need to think about the child in the equipment, the teenager in the equipment, to give them the best chance that they could have to not become an injury statistic of any form, and then to excel and have optimal performance to be able to get to where they want to go. So oftentimes they'll spend $300 on a pair of skates or $300 on a hockey stick, and they'll forget about that athlete that's inside that equipment. And so,
what's the cost to see you?
It depends on your age. Generally, the average treatment cost is around $38 to $40 average.
Okay, and covered by some health programs?
They're covered by some health programs, yes.
Right, okay.
Yeah.
Now, you talk about creating a profile for your clients called Health by Statistics.
Yes, yes. I like this thing. I think this is one of the coolest things I've come up with. Okay. If you're not feeling any pain, how well are you? There's no way to know if pain is your indicator that something is wrong. But if I could tell you, if I could provide for you something that could give you a statistical assessment of how well you are doing, would you be interested? Because being pain-free could be functionally just above that level of pain, or it could be at the optimal level. Think of an Olympic athlete who needs to compete optimally versus just a weekend warrior. They both may be pain-free, but which one has the better performance? So if we could provide a way to understand where you are statistically from a spinal perspective, would that be of interest to you? Most people say yes, and that's what we're able to do.
It's funny when we're going to go off to break in a moment here, but in the back of this Pro Adjuster magazine, which has your picture on it, by the way.
Yes, thank you.
Yeah, nicely done, by the way.
Yeah, nice picture.
It looks a lot like you.
Thank you.
Is that it talks about nerve function, and from vision,
yes,
to probably people having reproductive issues, to people that are having maybe bladder issues. All can be traced back to things that are going on in the spine. So when we come back from a break, we'll speak more about that, okay?
Perfect, yeah, great.
That's called a cliffhanger. I did that good. All right, stay with us. We're going to be coming back with more Dr. Dave Harper. And apparently nobody's in pain in Durham region, which is good, or we're just so good at talking about it, or we've already scared you off, in which case you don't even know what I'm talking about. We'll be right back with more First Take Live. Give us a call.